Hey everybody, it's Matt, Dyan. Welcome back to OK Aussie. Dyan's just said she literally felt a little bit sick 30 seconds ago. She's just gone straight away into a focal seizure. It is 7:21 p.m. It is Tuesday 14th of October. Bear with me as we just set things up. She was just painting her nails. Literally you can see the nail paint. I need to clear some space, get this safe. In case she goes into seizures, bear with me. I was trying to read. It's alright, Papa. It's okay. Hey Google, set timer 10 minutes. We're just starting a timer for Google right now just to indicate how long this seizure is going to last for. And when we apply medications. So that's ready. I'm right here. Fixed tone in left and right foot. Figure 4 position posture. Oromandibular. Blepharospasm. Left jaw thrusting. It's alright, kitten, I'm right here. We'll get you sorted out very shortly, okay? It's alright, Bubba. Very, very rapid onset. Literally in less than 30 seconds of early indications. She literally just said, I'm starting to feel a little bit unwell, and has gone straight into this. Wasn't expecting this today, to be honest. Diane's been resting all day. She has had a bath a couple of hours ago, but being a bath, it's lower impact for her. Just bringing pulse oximetry up so I can see where things are at. Seizure, 7:23. So right, kitten. Oxygen starts at 96, heart rate is 77. Alright. 37.5, so just on febrile temperature. Oxygen starts at 95, 94, heart rate is 70 and dropping rapidly. 65, dropping rapidly. 60. Okay. Right eye is fully closed. Oromandibular left side jaw thrusts. Hello, darling. It's alright. Can you look at what your blood pressure is? Inward rotation with both knees knocking, so coming from here, so there's probably some dystonia affecting in the lower hips. Still getting tics and things happening at the moment with the full body. Got midazolam as an anti-seizure medication ready to go. Just taking blood pressure to see where it sits whilst we're monitoring symptoms. 7:25 p.m. (119/79), almost at atypical, what should be perfect blood pressure for a normal human being, 120/80, 119/79, and a pulse of 65. Now remember, Dyan's baseline is not that. Dyan's baseline is actually 80/65. So for her, she's almost 40 milligram points above with systolic than she should be. Syncope at the moment, still got blepharospasm, I can see in the eyes. Hey kitten. Oxygen starts at 96, heart rate is 65. You feel sick? Ondansetron 4 milligrams, sublingual 726. Applying now. Excuse me. Sorry to scare you. Oh, Bubba. Forward tick motion of the cranial in an axial tilt position. Can't separate the mouth to be able to apply the ondansetron. Ondansetron is on standby pending resolution of the segmented cranial dystonia. Oxygen stats at 97%, heart rate is 70. Feet are okay, you can still see the hands. I'm still going with the seizures at the moment. Just going to reduce down. Hot pack is off, so there's no heat being applied. Nice, sweetie, I can see your eyes moving. I'm just going to pop that in under your tongue. That's just going to dissolve. So 727 on ondansetron, 4 mg sublingual wafer has been applied. They'll just melt in her mouth. It's all right, it's okay. I know you're going to feel disorientated. You've just had some seizures and some dystonia. You're feeling nausea. Just come on very quickly. I'm giving you some ondansetron. I know it's going to feel a little bit yucky in your mouth. Just let it melt away. And seizure. Here we go. 728, Clonic Seizure. All right. Okay. Okie dokie. Okie dokie. Let's keep that up in position. Let's see what's going on and why that's suddenly going through. Okay, great. Pillow's fallen down on her head. You can see she's unable to respond or interact with that. 3 minutes 36 remaining on the countdown. Syncope position at the moment, so she's passed out. Midazolam is ready to apply. Oxygen stats to 97. Heart rate did a dive there. That's why she's going into syncope. So the heart rate's coincided with a dive in heart rate. Hello, boo. I know. You're going in and out. You just had a couple more seizures. It's all right. Come back over. Just keep an eye on oxygen stats and heart rate during this time. Right, here, kiddo. 2 minutes 44 left on the 10-minute countdown timer. That countdown timer is just to give me an indication of how she's going, whether she's breaking out of the seizures and whether I'm applying the next level of medications. Quickly just checking her night medication status. Right, she's taking everything on schedule and on time. So all her normal daily medications, seizure medications and night medications are underway. She's still having segmented cranial dystonia that I can see from here. So you can see the oromandibular action in the mouth at the moment. It's controlling the eyes. The bathyphysium is controlling the eye, pupil movement, eyebrow and eyelids. The oromandibular is affecting the jaw, masseter muscles and the tongue. The thrusting is occurring here to the left-hand side, 7:30 p.m. We have 1 minute and 48 seconds left on the countdown. It's all right. Oxygen stats are 97%. Heart rate is 62. Hello, sweetie. Yeah, I agree with that. What's going on in your world? You're feeling cold and shivery. Well, you're actually running a little bit warm at the moment. Room temperature is at 23.8, so it's spot on as far as that goes. Yeah, not really. No, you're not. You're actually running warm at the moment, bud. Can you take some medication for me, Swallow? No. Okay, well, we're going to do that anyway. Yeah, Bubba, we're going to, because we're going to give you a muscle relaxant. No, it hasn't, sweet pea. Diane is always resistant at this point in phase to take medication. Hey, I don't have to give him Dazalan. No. So let's do this one with me.
No.
Yeah.
No.
I love you.
No.
You know I... Thank you. I love you.
No.
I love you. But I need to.
No.
Yeah, I need you to.
I
So.
don't need it.
Yeah, you do, darling.
Why?
Because of what's going on with your body with the dystonia. It's going to help those stop. See that? That's the dystonia. So before you go at the point where you can't swallow and you go unconscious again, I need you to focus and work with me, please.
I want it.
I need you to.
Wait.
No, darling, I can't wait. The time limit's up for it, please. I need to apply it now. Okay? I'll put it on your tongue. Good girl. I'll give you a drink. You do the thing. Have a secondary swallow. Hey Google, stop. That's the 10-minute countdown. Any more seizures after this point in time? We're going to be applying midazolam. 2 separate medications. Midazolam should actually manage the tonic-clonic seizures, and hopefully we're out of a set of those. Careful that she doesn't aspirate, but that's definitely giving an oral medication. We're still trying to get hold of a liquid medication, which is equivalent. A little bit up, but not too much still. A little bit, just to the... Oxygen stats have just plummeted down 92, 91%. Heart rate's at 70. Dyan can go in and out with syncope during these sort of phases, so we're just going to get the medical oxygen concentrator ready to go, just in case. Have you had any chest pain, Dyan?
Why?
No. Do you have any headache, Dyan? Before?
Oh no.
Okay, so you had some before this started?
Mm-hmm.
Okay. Anything else in your body is hurting that I need to be aware of?
I was just feeling sick.
Sorry, you're just feeling sick?
Yeah, it's saliva building up.
Okay, so the nausea at the moment, I've given you some on Danzatrot. How's it feeling now for you?
Better, but it's...
It'll take a little bit more time before that to totally kick off.
I have the saliva in my mouth.
Don't have the saliva in your mouth, right?
It's not building anymore.
Okay.
I still feel sick,
You still feel sick.
but it's not as bad.
Okay, we're going to wait a little bit of time to see how the Danzatron kicks in. I can give you some additional Danzatron after that time, okay? No, exactly. We're just going to stick with what we've got given at the moment, alright? Wait to see if it kicks in. Oxygen stats are flapping a little bit. She's back up now to 96. Heart rate is at 66, 64. Alright, let's see how that lays out for her. Right, where did this come from?
I did a thing.
You did a thing.
I was tidying my storeroom.
So you hopped out of bed, you walked to your storeroom, you walked back.
And I've been editing all day.
So you've been editing your videos in bed, and you feel that you've pushed yourself over the limit, okay? So PEM, post-exertional malaise, too much in a day, and you've tipped yourself over. Okay, it's alright. You've got to rebalance and not do as much. Oxygen stats are 97%, heart rate is 71, 72 and climbing. You got things to do? Right.
Yeah.
Let's just get a pillow underneath your head.
Is it good?
I don't know yet. The tonic-clonic seizures seem to have stopped, which is nice of it. It's 7:35 p.m. Your oxygen stats have been flapping around a little bit. We've had a couple of drops really down low, but it's stabilised now at 97. Heart rate is at 61. Okay, so you had a focal seizure to start off with. Were you aware during it? Your mouth is moving, yeah, that's...
Yes, I was
Okay.
aware.
Okay, and that's the problem with the focal aware seizures. You're having the seizure, you're having the sensations, but you can't communicate, okay? So you don't have the ability. Okay. Okay, that makes sense. So after the focal aware seizure, you went into tonic-clonic seizures, and you've had dystonia as well. So that little things that are happening on the side of your mouth is dystonia, segmented cranial dystonia, or mandibular. That'll pass with the medication I've just given. Okay.
Are my nails dry?
Hey Google, set timer 15 minutes. Now the clonazepam that I've given you, in the next 15 minutes we'll stop that and any other further tics and things occurring as well. So let's see how that goes. Chest is still feeling okay?
My nails dry.
Yeah.
I just done them. And
I
laid
know.
Down.
I know, right?
I didn't know it was coming.
No, you didn't know it was coming. And unfortunately, in the evening time, it is 7:36 p.m. Evening time is more prone as the day gets longer. Particularly because of the energy, the more that you've burnt your energy, your amount of spoons, if you think of spoon theory, or if it's simply like a battery, your battery's worn down, you don't have that capacity anymore. You need to recharge, rest, and recover.
I challenge it all the time.
Yeah, well, it's sometimes good to challenge, but there's also a balancing act. If you challenge too much, you're just putting yourself at risk. Now, look, there's a high precedence, higher threshold level for having seizures with Dyan's genetic condition called 22q11.2 deletion syndrome. 65% of patients with that condition will have seizure and seizure-like condition. 8.3% will have epilepsy specific. Things like this post-seizure, the tics, which is part of the motor condition, Tourette's for Dyan, is quite common. Sometimes there will be vocalized tics that go with this as well, such as coprolalia, which is the inappropriate language. That might also be seen. So you can have Tourette's. But dystonia is a bit of a side, but also a neurological condition as well. Dyan will have some syncope or pre-syncope, and that's part of where the passing out occurs. You're not getting enough oxygen. You can see at the moment in the face, the oromandibular still taking control of those muscles, and that's why we've given the clonazepam to help take control of what's happening with the muscles that are in the face. Those muscles are not in Dyan's control, that are affecting around here, the closing or opening of the eyes, any of the fibrillations or the shaking that you might see, or the jaw thrusting or the bruxism, which is the grinding that may occur. That's out of Dyan's control. We hope that the medication we've just applied will actually start to ease all of that out very, very quickly. Winston I've got over here. He's just out of the way for the moment. I'll bring him back. We've got Willow over there on the tower. Maximus is on the tower out there. He's actually, both cats are in relaxation mode. They're chilling. Oxygen stats are at 94% at the moment. Heart rate is at 67.
Because Max was helping me in the story.
Right, well,
He helped
that's
me.
Winston, the sausage dog. He's right there. Winnie, it is 7:38 p.m.
Max had fun in the
Oh, I'm glad Max had some fun in the storage room. Good on him.
But he got mad at me for going in the art room without him.
You left him out of the art room. I heard him meowing at the door saying, "Mummy!"
And I forgot one job I've got to get done today.
Well, a little bit later on, once you've recovered, recuperated and rested, and once I see where this is going, then I'll actually know what's actually happening. Now, I haven't applied the midazolam ASM medication because the Clonic Seizures have self-terminated in under a 10-minute window. So it was non-contiguous, it wasn't continuing through. There was interspersing gaps of syncope with dystonia, and there were several sets of tonic-clonic seizures, but under my threshold, I haven't applied the ASM, but I have given Dyan some clonazepam, which is a muscle relaxer because of the dystonia that's still going in the tics, or as well as some ondansetron because the nausea is obviously quite strong. There's been no heart involvement, and I think the use of the potassium that we now have down for Dyan is stopping the arrhythmias and reducing the angina, so that has really settled down a lot of those heart conditions, also pursuant to 22q11.2 deletion syndrome.
I was seeing blue and green.
Well, we do get that, don't you, when your potassium's not right. It has a colour field with your gaze.
I asked the doctor and I said, I'm seeing green.
Yeah, and that actually is a side effect. It's a visual disturbance side effect. Don't ask me how it works, but it's something which is an indicator. The chromosomal condition that Dyan's got, 22q11.2 deletion syndrome, used to be called DiGeorge syndrome, velocardiofacial syndrome, BCFS. Sturgeon's, there's a few other names, catch 22.
That's what one doctor a while ago said I had Sturgeon.
Yes, correct, that's part of that as well. The proper name that we use these days is the genetic moniker that actually represents the position in the 22nd chromosome. We all have 23 pairs of chromosomes. On Dyan's 22nd chromosome, she has a micro deletion. She's missing about 30 to 50 genes, 3 million DNA building blocks, and it does affect anywhere up to 180 clinical symptoms, 185 actually clinical symptoms. Autism, ADHD, OCD. In fact, autism is about 20 to 30% seen genetically in this condition. ADHD is about 40 to 60% in this genetic condition. Seizures, like I said, it's about 65%. Cleft lip, palate, high palate, which Dyan's actually got. I've seen about 60% of patients with this condition as well. Hypermobility, so she has Ehlers-Danlos hypermobility. A whole range of things. Gastrointestinal issues, so gastroparesis is actually seen. Skeletal issues like scoliosis, CCI, craniocervical instability. A whole shit show of different things, haven't you?
What I managed without a peg and a tube.
I know, right? Someone's actually asking about that today because of the intense nausea, GERD, reflux and things that you deal with. You have an incredibly modified diet.
I have to because I have foreign body.
You do, and with mast cell activation syndrome and anaphylaxis, you actually respond to things like the nasal gastric tube, and if you were to have a port, we don't know what that might actually do. So there's a lot of issues pertaining to this condition that you have to actually deal with, unfortunately.
I have to do it the hard way.
Now, I'm really good, and this is why we had this conversation with Dyan after a seizure, just to see cognitively where she is. Post-seizure, post-ictal phase, she might actually have more aphasia, difficulties with speech, word finding, stuttering or slurring.
That was
Cognitively, you could be offline, but you're coming around quite well.
That was the
Good.
main problem when I was born. My mum said was feeding.
Yeah, it was feeding, and it's very hard to do that latch on
Colic.
because and colic is more prevalent because of the high palate affected issues.
For 6 months.
Absolutely, and it affects the swallowing as well. It's part of that whole system.
Yeah.
That's why you have more likely to have dysphagia. I'm not seeing much more of the
I used
dystonia
to
in the
choke
face. It
as
seems
a-
to be settling.
I don't know. I used to choke as a kid and get blamed for it.
No, you've been blamed for a lot of things, all based on your genetic condition or your disability. Pretty crappy, I know, but it's out of your control. It's not your fault, sweetie. It's something
I
you're born
wasn't
with.
stuffing my face. It was
No,
just,
you were not stuffing your face, darling. I know that.
Or I wasn't eating too much to throw up. It's
No.
my tummy.
Oh, hello. Who's this? Have you come to say hello? Oh, it's about time you haven't done your job. You're meant to be Mum's support cat. How's that working?
Look what he's doing. He's making biscuits.
He's making biscuits. Okay, well, we've got Max on the job, so that's a good thing. About time you turned up, like I said. You going to give Mummy a cuddle?
I need a Max.
Come on.
cuddle.
Have a Max cuddle.
I need
Max
a
cuddles are always a good thing.
cuddle.
Oxygen stats are stabilised at 96% saturation. Heart rate is at 67. Still a little bit of flapping going around. It's not really what I'd call stabilised at the point in time. You are still feeling a bit warm. You're 37.5 on the temperature,
He
sweetie.
smells my nail
He
polish.
does smell your nail polish. It's like, yeah, what's that? Horrible nail
I'm
polish.
sorry.
Do you feel warm?
Yes.
Yeah. I need to give you some
But I'm
Panadol.
cold at the same
That's
time.
okay. Because of your temperature 37.5, I can give you a tablet to swallow, or would you like a liquid Panadol? Your choice.
Which one works better?
The Panadol Osteo, I thought was a better delivery and more sustained.
That one.
It's not a big
It will
duration.
last me in the night.
Yep, no worries. Panadol Osteo 665
Wait.
applied. It's currently 7:44 p.m. All good? Lovely. Oxygen stats remain at 97%. Heart rate is at 78, 79, 82 and increasing suddenly in the spike. 84, 85. Why are you increasing suddenly? I don't know either. Hop over there, Bubba. So thank you, flat.
My mouth is watering again.
Okay, no worries. Well, you've got that just if you need it. Just going to borrow your arm.
Yeah.
Don't know if we're totally out of the woods as yet.
Yeah, I thought. Yeah. Jinx it.
Let's just see how you're sitting right now.
I jinx it.
Now we still have 5 minutes 54 on the countdown time. That's just looking at the clonazepam effect to see how that's working on things such as the dystonia and obviously the tics. You've got numbness on the right cheek. Okay, just relax for a moment while we just take blood pressure. Just want to see where that's actually sitting. Oxygen stats at 96, heart rate is 58. Bit of a squeeze. It'll ease off in a moment. So Don's gone down from being 119 over 79 to being 105 over 69. So she's reducing now. So the blood pressure is starting to come down, and I expect that will go down even further in the next 15 to 20 minutes. So we'll keep an eye on that progressively. Just 2 seconds. Oxygen stats at 95%. Heart rate is 56. It is Tuesday, the 14th of October, 7:48
Why does it
p.m.
feel like a Sunday?
I don't know. Why does it feel like a Sunday? Why are you doing that?
Because you to me when we first moved out.
I know.
In the kitchen. And it hurt.
I used to flick you.
Yeah.
You used to get me back.
Yeah, I know, but
No,
it
right.
hurts, man.
I'm sorry, dude, but you know, gotta think quick. Gotta, you know, be on your toes.
I'm not good at it.
No, you're not very coordinated with that sort of thing, are you?
Can't do it.
How's the body and the brain feeling right now?
Foggy.
Foggy. So a bit of a brain fog, feeling
Tired.
tired. Then we come up a little bit.
Thank you.
It's okay. Deep yawns are what we look for after seizures. Normally the indication that the seizure sets are over. Whether that's a grab for oxygen from the oxygen starvation, knocking enough oxygen to the brain, more of an indication of relaxation is what we look at it being. And that's where she commonly is. So commonly we'll see about 3 or 4 deep, really
My
felt.
stats okay?
Yes, your stats are actually okay. You're 97%
No,
in
the
the
whole
oxygen.
time.
Heart rate 60. During the whole time, no. Your oxygen dropped down to about 91%. It didn't hit the threshold over. Heart rates had a few little fluctuations up and down, but that's to go with the amount of convulsive movement. Obviously having generalized dystonia, having tics, having obviously tonic-clonic seizures takes a lot of energy. It's almost like doing a gym workout. And each time it reflected, every time you had a heart rate drop, you went into syncope. And again, that matches when we see a heart rate drop of about 15 to 20 beats per minute.
My plan was to do physiotherapy tomorrow.
Well, it still might be, but we're going to be relaxing you up today. You've been having a resting sort of recovery day is what it's meant to have been. Do you have any head pain at the moment?
I did a lot of jogs.
Yeah, but it
But
doesn't
there were
help me.
small things.
They were small, but only little things, but little things still make a difference. Right, oxygen starts at 97, heart rate is 60. I'm hoping that you're a bit more stabilised. Feeling that way?
I don't feel like it's going to happen.
Alright, that sounds good. You haven't bitten your tongue, cheek or lips? What's that tongue doing? Put that away. All good. Sounds good, looks good.
Doesn't hurt.
Okay, you haven't hurt your neck at all? Or
Yes.
shoulders? Neck, okay.
Both sides.
Both sides. Unfortunately, having the roll and doing
Mainly
tonic-clonic
this
seizures
side.
don't help you for the pain side of things. I get that. We might need to wear your soft neck brace. Second of the strong yawns, that's where we're going to wrap up. It's 7:49 p.m. About 2 minutes left on the countdown timer up there for the clonazepam. I think things are starting to relax.
What's that?
The clonazepam is the muscle relaxation medication, a little white circle one that I gave you, 2 milligrams. And that's help you with dystonia, and that's to help you with tics, commonly seen during this, and that will help relax and stop those. All right, guys, thank you so very much. Yes, you actually. You have had some Tourette's today, haven't you?
Yeah.
Yeah, vocalized Tourette's particularly today, right? Yeah. And echolalia?
Oh, yeah.
Lots of echolalia today.
Oh, yeah.
Oh, yeah, right? And a lot of time too, if you're actually very observant to Dyan's variables, you can start to measure and quantify a lot of the neurological indicators, whether it's a migraine headache, whether it's sleep patterns, whether it's aphasia type behaviour, more stuttering and slurring, whether it is things like the Tourette's coming through more predominantly, whether it's even the walking, the gait style, energy levels. A lot of these things can contribute us to create a picture to indicate if she's going to have a seizure or how bad it is. So we try to be as observant as we can. A bit difficult with the interoception because Dyan doesn't always conversely explain and tell me until after the fact. She says, oh, I should have told you. I was going to tell you. Oh, I forgot to tell you.
Actually,
Yes, actually what?
I was going between the art room and the storeroom, fiddling around.
Yeah.
With just shuffling items around.
And what did you not tell me about?
Zhuzhing.
Yeah, you were zhuzhing. What did you not tell me about?
And I felt like I went as if I'm in an elevator.
Okay, so you felt like a gait issue where the
When I
legs,
leant
the
over.
suspension dropped out a little bit on you.
Yeah, I was standing up. I was leaning over.
Okay.
Putting things on a bench, and I just felt this that feeling you get on a lift.
Very helpful to tell me those things. Gait-related issues like that, we normally see tonic-clonic seizures within a 24-hour period of time.
I was standing still, leaning over, and it was like.
The more predictive information that I have, I can help predict and work out whether things are going to happen, and then be prepared and ready for them, rather than the surprise of, oh shit, it's here. Hey Google, stop.
That was just, and then I did this, sat down and did this.
Yeah, so it was only about 10 minutes, 15 minutes beforehand. It's a pretty quick onset then. Interesting. Guys, any of the information that we share and show you is actually specific to Dyan. It pertains to her health,
And
her
it is
condition, her
dry,
treatment, her
isn't
management. It is. I haven't seen anything except a little bit on your skin, I think on your thumb.
Isn't that
It's not for
lucky?
you. We don't do this to diagnose you or give you guidance.
yeah.
That's what your own GP, primary care physician, or specialists are for. So please go and seek them for guidance and geneticists for genetic testing and to work out whatever symptoms or conditions that you may have. But we are here to educate and advocate for rare diseases. There are over 7,000 rare conditions. Only 5% of those conditions actually have any treatment or management plan in place to date. It normally takes about 8 to 10 years to get a diagnosis for really rare conditions. If you go to rareportal.org.au, if you're in Australia, it gives you some good ideas and information on some of the rare conditions and support groups that relate to that condition. Rare Voices. There's also a national guideline for managing rare conditions, which is available, which hopefully your doctor or specialist will follow, because look, no one can be expected to be an expert in all the rare conditions, but they should follow due course and actually reach out to centres of care of excellence, and that might be overseas or interstate, because like Dyan's condition, there is no adult specialist for her condition across all of Australia. There is lots of useful information at the Mayo Clinic and other type of centres overseas, Johns Hopkins University, for example. But in Australia, we're lacking that. So I do feel you. Guys, if you're new to the channel, don't forget to subscribe, hit that notification bell, big thumbs up of encouragement, hype to support the channel, and comments, questions, ideas, and suggestions, leave them below. Max, are you going to say goodbye, buddy? Hey?
He's fixing me.
Hey?
He's
You're
a
so
Dr.
good.
Max. High
Hey?
five, Dr. Max.
High five. All right, guys, going to love you and leave you. Dyan's on the mend.
Bye.
And keep an eye on her. Thanks for watching. Bye for now.